Hey guys, my name's Brecken. I'm going to talk to you a little bit about advocacy in health promotion and disease prevention. So a little bit about myself. I'm a family nurse practitioner, more often referred to as NPs. I specialize in urgent emergent medicine. Specifically, I currently work in the urgent care setting, but I have a background in emergency medicine and surgery as well. I've had the chance to work in the medical field about the last 12 years, so that's given me a lot of various opportunities to work in different capacities and see different perspectives on how advocacy in these areas can be implemented. So whether it's through different people and their jobs, roles, we all can play a really important role in advocacy for patients and clients. I think it's a really important and often under-discussed topic that each of us can and should have a hand in some way or another. So while some of the specific career paths will likely have a much more active role in this, I think that we can each play our own part in some way. I'm fortunate enough that in my particular career, advocacy is a huge part of what I do. So first, let me explain what a nurse practitioner is, for those of you who don't know. So an NP is a licensed and autonomous clinician. We are authorized to diagnose, treat, educate, and provide evidence-based care to patients, both individually and in collaboration with other physicians and advanced practice providers. So our educational background will start with a bachelor's of nursing. We're then required anywhere from 1 to 3 years of practice clinically as a nurse before we can apply to and begin our graduate programs for advanced practice nursing. There's different specialties that we can all go into, but you'll find us in a variety of settings these days, from family practice, emergency medicine, hospitals, women's health, pediatrics, psych, and even specialty care, cardiology, neurology, dermatology. We're a pretty fast growing group, so you're likely to run into one of us at some point. Really, one of the fundamental principles that nursing as a whole is founded upon is patient advocacy. In our code of ethics, it states that nurses promote, advocate for, and protect the rights, health, and safety of patients. So the role of nurse practitioner was actually created in response to people not having access to high quality care due to few doctors and healthcare costs being too high. So the result of that was that nurses kind of went to bat for our community as a whole, and we're actively lobbying for an expansion of our scope of practice in order for us to be able to provide that kind of care for patients. So we were created in essence to bridge that gap and to in turn be able to provide quality care to people, specifically our vulnerable populations. So I definitely have a passion for patient advocacy, as it's kind of a founding principle of what I do and ultimately why my career even exists. So I think it's something that can have a really huge impact on people's lives and can ultimately change their lives. So I, as a nurse practitioner, am uniquely positioned to have both the authority and the means to educate and care for people in a way that promotes overall health and wellness. I think that a huge part of advocacy in relation to health promotion and disease prevention is simply education. People don't know what they don't know, and those of us who are fortunate enough to be trained and educated in these things share a pretty large responsibility to in turn educate our fellow man. One of the greatest ways that I'm able to promote health on a large scale is simply educating my patient on different disease processes they may be at risk for based on ethnicity, gender, health status, family history, etc. I get to teach them things that they're at risk for and also teach them how they can actively participate in their own health and wellness in order to prevent these things. Usually what I find is that these people genuinely have no idea. It's what may be common knowledge to a lot of us who are in fields related to healthcare or who are going into fields that require healthcare courses like this that teach you some of these things that you may think are common knowledge is genuinely not common knowledge to everyone. So something as simple as having a conversation with a patient or a student or client of yours can have a major impact on their life.